Hello. Hi, I'm Louise and I'm the Support and Information Centre Manager at both hospitals in Essex and Suffolk. And it's a real privilege to be here with you this afternoon and have the opportunity to share our innovative project during COVID. Next slide, please. So we're lucky enough to have a cancer support and information centre at both hospitals, and usually our doors would be open and we'd be welcoming, between 50 and 70 patients and loved ones a day with a variety of support and information needs. And prior to COVID, we were very active running education sessions and courses and exercise groups, and we were in the heart of our cancer services department and able to respond to people's individual needs. And then COVID hit and our doors closed. Can I have the next slide, please? So it's been described as a global catastrophe, the greatest challenge that the NHS has ever faced. And like a lot of us have recognised, out of adversity can come opportunity. And we very quickly realised that if our doors were going to be closed, we needed to reinvent ourselves and come up with a different way of meeting our patients' needs. Next slide, please. We know that the role of a cancer nurse specialist in a cancer patient pathway is vital. And all the research and evidence tells us that patients and loved ones have a better experience when somebody who's got knowledge, skills and experience in what they're going to have to face, their treatment choices and the support that they need, when that person's involved in their care, that their experience is better. But what happens when that support is suddenly unavailable? And for our trust, we had to close our information centres, but we also had to redeploy the majority of our nurse specialists. And we moved our cancer services to our local private hospitals. And so for our cancer patients, they were unable to access the clinical support that they'd had. The nurse specialists didn't have access to their phones and they weren't able to respond in a timely manner to patients' worries and concerns. And for cancer patients, we heard that for them it was a very frightening time. There was a lot of uncertainty, a lot of loneliness and isolation. And they were unable to access the support systems that they so needed at this challenging time. They also faced diagnostic and treatment delays because obviously urgent services had to be prioritised, and many of our patients were told that their investigations were cancelled or their treatments were cancelled and they didn't know how long for. And they were also hearing that because of their diagnosis, they were at greater risk if they contracted COVID. And so they were told to isolate, not go out. They had no way of accessing shopping, food, support. And they were also facing an increased financial burden because many of them were told that they wouldn't be able to go to work if they'd been trying to work during their treatment, because that place them at increased risk. Next slide, please. So we felt that what was needed was a cancer helpline, and within the space of a week we redeployed staff to our cancer helpline. We got the equipment and the IT resources in place that we needed, and we found that this was a great opportunity to use and utilise skilled staff who were unable to work in their own clinical areas, perhaps if they had their own COVID risks, but also if their departments had been closed or their role was no longer required at this time, we were able to redeploy them to the cancer helpline. And we had a very eclectic team with lots of different skills. We had hospital managers, we had nurses from the wards, we had volunteers, and we were really lucky to have patients and carers as part of the team, and their insight and input was invaluable in helping us make sure that the helpline met the wide variety of needs of this patient group. We were in a storm, all in different boats. Patients and families faced greater challenges than the rest of the population. That's what they were telling us for the reasons that I've outlined. And what they told us was that the helpline was a life raft, keeping them afloat during a terrible time. They were able to speak to somebody straight away. And, you know, despite knowing that having a CNS and access to a CNS is very valuable, we also know that sometimes CNSs are overwhelmed. They're not able to answer their telephone calls or clear their answer phones in a timely manner. And we also found when we were setting up the helpline that secretaries and reception teams were also experiencing the same challenges. And so we were able to camp all of those phone lines to the helpline and remove this challenge and burden and help our colleagues by dealing with all the phone calls in a very timely way. So we had a central contact number, and switchboard signposted all cancer inquiries to us, and every call was dealt with in a timely manner, resolved quickly or by the next day. And it was very personalised. What matters to you? What's important? What can I help you with? And we were able to liaise closely with the clinical teams. One of their initial worries were, would the helpline staff be equipped to deal with the inquiries? Would they have the skills and knowledge? But we were able to liaise with them and deal with the majority of the calls without having to seek additional help. We put in place a callback service, so patients and carers really liked the fact that, you know, there was somebody that they could contact quickly. So we said, would you like us to call you back next week? And that helped deal with the loneliness and isolation that a lot of patients and family members were experiencing. It was really hard for them in those initial months to get their shopping and get registered for help. So we were able to establish a website with postcode relevant resources and support so that people could access shopping and get help with picking up their prescriptions and get the support they needed in their local village or community. And that was really valuable. We were able to get them registered on the government shielding list and get support to them quickly, and also help get them registered for their vaccinations, because we found that a lot of patients who were told they needed the vaccine couldn't actually access it, so we were able to support with that. So from initially being a helpline to deal with worries and concerns, we very soon were able to put in place additional support and resources so that we could holistically meet people's needs and make it very personalised care. We also asked all of our inquirers if they'd be happy for us to send them a satisfaction survey, and after a few weeks we did that, and we repeated it throughout the lockdown and throughout the pandemic over the last 18 months, so that we had a really good and clear indication of whether we were meeting patients' needs and what else we could do to make the service better. Next slide, please. We had in July over 900 calls, an average of 50 inquiries a day, and that was spread across the week. It was a very busy service, but it was a pleasure and a privilege to operate the helpline. There was great camaraderie between the team. There were 6 helplines operating every day, and people who volunteered or were redeployed to us, they didn't want to go home some days. They felt a great sense of reward in being able to offer this valuable service to people, and it was very humbling. And the feedback that we got was so inspiring that people were actually asking us when they heard, can we come and help you on the helpline? And if we'd have had more space, then we would have taken them on board. Next slide, please. What was interesting, and I mentioned before that, you know, some of the clinical team wondered whether we'd be skilled and equipped to deal with the inquiries. The majority of the inquiries were around support and signposting. They were non-clinical, and this was a real eye-opener for us, because what it told us was that the helpline could be a really valuable source for our trust to continue, take the pressure off those clinical teams, triage and filter the calls so that only the clinical ones and those that needed to go to the nurse specialists and the secretaries and receptionists could be done, and then the other calls could be dealt with by the helpline team, and they could be signposted to all of the wonderful services that we have on offer that they may not have heard about, you know, had they not contacted the helpline. So when we talk about a helpline during COVID and beyond, what we're now looking at is how we can embed that service, that single point of access for our cancer patients, their families and loved ones, so that they always have somebody that can answer their call immediately and they don't have to wait, but their needs can be met by the right person at the right time, and they also get to hear about all of the valuable services that are on offer, because often patients come to us in the information centres and say, I wish I'd have known about this sooner, you know, why didn't anybody tell me? So I just want to say that there's an important role for a helpline. It's a transferable service across trusts. We know CNSs can be overwhelmed, but this actually showed us that there was a greater level of satisfaction from patients and their loved ones through the introduction of this service, and it was an efficient use of resources at a challenging time. Thank you.